Everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, we're going to be discussing a medication known as Fenofibrate. Its brand name is Tricor. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. In this video, we'll discuss the mechanism of action or how this medication works, indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Fenofibrate. Then touch on examples of dosing, and then finish it off with side effects with percentages. I've put together some slides to go over this information, so let's jump right into it. So the first thing to discuss here will be the mechanism of action, or how this medication works. So Fenofibrate increases lipolysis and elimination of triglyceride-rich particles from plasma by activating lipoprotein lipase and reducing production of apoprotein C3, which would be an inhibitor of lipoprotein lipase activity. In terms of indications or reasons we would prescribe Fenofibrate to a patient, we may see this medication used in the treatment of hypercholesterolemia or high cholesterol, as well as in the treatment of hypertriglyceridemia, or when a patient has high triglycerides. With respect to contraindications or reasons we would not be able to prescribe Fenofibrate, we wouldn't give this medication to a patient who had a hypersensitivity to Fenofibrate or to any other component of the formulation. If a patient had severe renal impairment or gallbladder disease, they would not use this medication. It would also be contraindicated in patients who have active liver disease. Nursing mothers should also not use Fenofibrate. Now for some examples of dosing with Fenofibrate. So in the treatment of hypercholesterolemia, using the tablets, we would see a dose of 160 milligrams orally daily with food. And that would be the maximum dose, 160 milligrams daily. If they're using the capsules, we may see 150 milligrams orally daily with food, with a maximum dose of 150 milligrams daily. In the treatment of hypertriglyceridemia, with the tablets, you may see 54 to 160 milligrams orally daily, and again with the capsules, you may see 50 to 150 milligrams orally daily. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Fenofibrate. I'll go over some of those here now. Nausea may happen about 2% of the time, while abdominal pain may happen 4.5% of the time. 7.5% of patients may experience abnormal liver function tests, and 3.5% of patients may experience a backache. Rhinitis may happen 2% of the time. Now, one serious side effect with Fenofibrate would be pancreatitis. Alright everybody, that's all we're going to talk about today with Fenofibrate or Tricor. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.